Hi, I'm Lisa Herrera and I'm in Dr. Levy's class. I'm going to briefly discuss autism. I think that autism awareness is extremely important because 1 in 110 children in the United States is affected by this disorder. Chances are you already know somebody with autism, so I'm going to briefly discuss it in a PowerPoint presentation. The Autism Society of America defines autism as a neurological disorder that affects the normal functioning of the brain, impacting development in the areas of social interaction and communication skills. Autism falls under the umbrella of pervasive developmental disorders, and PDD is a group of disorders that are characterized by delays in the development of multiple basic functions, including socialization and communication. The 5 disorders included under PDD are pervasive developmental disorder, autism, Asperger's syndrome, Rett syndrome, and childhood disintegrative disorder. Some characteristics of autism are sensory motor deficiencies, such as in the fine motor skills and the gross motor skills. Some examples of fine motor skills deficiencies are that some children may exhibit difficulty with pencil grasp. They may exhibit poor formation of letters, shapes, and numbers. Difficulty manipulating objects with their hands, and difficulty with spatial awareness. Some examples of gross motor skills that they may be deficient in are poor writing posture, difficulty with balance, and difficulty with jumping, skipping, or hopping. Another characteristic of autism is communication and social skills deficiencies. Some of the children may or may not exhibit no interest in socializing. They may avoid eye contact, or they may have delayed speech or no speech at all. Also, another characteristic of autism is restricted or repetitive or ritualistic behaviors, interests, and activities. Sometimes you'll see a child engaging in hand stereotypy or vocalizing. And also, you may see children lining up objects in the environment, such as their toys. Also, some of the children with autism may exhibit perseverating on topics of interest to them, such as a child may be interested in trains. They will constantly talk about trains or find out facts about trains or baseball, anything that may be of interest to them. Some theories on the cause of autism is the first are the vaccines. Some people in our field do feel that the thimerosal in the MMR shots may have caused autism. Another theory is genetics, and some people believe that there's some sort of gene marker or it's hereditary, and that's how autism is caused. Another big theory out there is the environment. It's environmental. So some experts believe that some sort of pollution or something in the environment has caused autism. And there are so many theories on why autism is there. And some other examples include food allergies or immune deficiencies. In the beginning, when autism first came out, it was believed that there was a theory called the refrigerator mom theory, and that theory was that if your mom was a very cold person, that you would have autism, which I think is very barbaric and absolutely absurd, but that was actually a theory. But the bottom line is that there is no known cause at the present time. Some educational approaches to autism are applied behavior analysis. And applied behavior analysis is a science in which the principles of behavior are applied systematically to improve socially significant behavior. Another approach is teach, Teach is is a structured teaching system that focuses on the person with autism and the development of a program around the person's skills, interests, and needs. Another approach is a picture exchange communication, also known as PECS. And PECS is a program which teaches children and adults with autism and other communication deficits to initiate communication with the use of pictures. Another approach is social stories, and social stories are used as a tool for teaching social skills to individuals with autism. Stories are developed about a particular situation or event, and they're applied to the child's life, and hopefully the teachers will use social stories in order to teach certain events. So if a child is supposed to learn how to go to bed, the teacher may write a story about going to bed and how important it is and why we go to bed and how do we go to bed, and this will hopefully generalize to their regular life. Another educational approach is a facilitated communication, and this is based on the idea that some people are unable to communicate because of motor deficits that prevents them from expressing themselves rather than a lack of communication. Facilitated communication involves the use of a facilitator who helps the person communicate with the use of a computer or an augmentative device. Another educational approach is sensory integration. And sensory integration focuses on desensitizing an individual and helping them to recognize and distinguish sensory information. So these are just a few educational approaches on how to teach children and adults with autism. My own personal experience in this field is that I've actually been in it since 2001 when I was an undergrad student. And currently, I'm a consultant for a private school in Queens for children and young adults with autism. On an everyday basis, I use an applied behavior analytic approach to teaching children with autism. I look at autism as individualized disorder. It's not one general disorder. I really feel that it is so different for each person, so it's definitely individualized. I feel that with individualized attention and early intervention, many individuals with autism grow to live independent and productive lives. If you have any questions, please feel free to ask them on the discussion board. Have a great day. Bye.